Hello and welcome to the Safety and Quality Education Program podcast. Developed by Metro North Health Safety and Quality in partnership with the Clinical Skills Development Service. Metro North Health acknowledges the traditional custodians of the land upon we live, work and walk, and pay our respects to elders past, present and emerging. The Safety and Quality Education Program has been designed with a focus on patient safety improvement. Each episode will explore ideas and stories in making our care delivery safer for our patients through the implementation of short notice accreditation. Our host is Dr. Mia McLanders, who is the Manager of Research at Clinical Skills Development Service. Mia is an applied researcher with a background in human factors and cognitive psychology. Joining Mia on this episode from Metro North Health is Grant Carey-Ide and Martin Canning and Dale Trevor. Grant Carey-Ide is the Acting Executive Director of Clinical Governance, Safety, Quality and Risk. Grant has an extensive background in safety and quality senior leadership roles and is lead assessor for ACHS accreditation. Martin Canning is a consultant pharmacist at Metro North Clinical Governance, Safety, Quality and Risk. Martin enjoys developing, implementing and evaluating changes to systems to support safe medication use, resulting in best patient outcomes. In this episode, our guests explore medication safety and how clinicians can support safe medication use for our patients.
So Mark, you've seen some changes over the years. Can you tell me about those?
Yeah, I think some of the biggest changes have been the role of pharmacists on the ward supporting optimised medicines for patients. I think that, I've been fortunate. I've seen that transition through my career where we only had small numbers of pharmacists on the wards supporting patients to get their medicine safely, and now they're everywhere. I've spent some time out in some of the directorates the last couple of weeks doing some peer assessments, and you can't go very far without stumbling upon a pharmacist who's got their purple pen, reviewing the chart, educating a patient, helping a nurse administer a medicine safely by giving some advice. Yeah, it's been a huge change. I think the implementation of technology through things like automated dispensing cabinets for medication storage, through digital transformation with the IMR, which is coming, I think are huge opportunities, and I look forward to seeing those come. And I think the biggest benefit, or one of the benefits from my perspective with that, is that use of the data that we can use to do exactly what Dale said, just continuously improve to improve outcomes for our patients.
Grant, I see you nodding over there. You've seen some more of that sort of pharmacy involvement and the accreditation through your processes of accreditation. Tell me what you've seen.
I was nodding about Martin's comments about seeing increasing numbers of pharmacists on wards and the capacity that they have opportunistically to support nurses in administering medications, but also in guiding doctors, particularly junior doctors, in the things that they are prescribing, around the contraindications with other medications that the patient might be receiving. And how positive those changes have been over the years. I can remember as a very young nurse being taught to never question the prescription, but simply to administer it, nurse. That is your job. And it's a joy to, all of these years later, be in a place where a nurse is empowered to go, hang on, I'm not sure about that, so I'm going to check it. And they will check it with that person in purple on their ward that we know is called a pharmacist. And that's a fantastic thing. Or they'll check it with the patient and go, is this what you'd normally take? And listen to what the patient tells them.
Dale, have you had that experience as a consumer?
Yes. Look, I think what the boys are explaining here is a team approach where all eyes are on the patient, and we want patient-centered care, we want multidisciplinary teams, and what they're explaining here, I think, is that everybody has input. Nobody has their mouth shut because of a hierarchical structure, but a team approach where everyone on the team can question something, and even if they're wrong, they can learn something from that, So we're increasing learning all the time, and all of these things have to end up with a better outcome for the patient, because you've got a team approach rather than one person going, gee, I hope I've got this right,
Mm.
And they can check that through various means.
This is sounding like, the gold standard of standards. It's, it sounds like it's a standard that we're really getting right. Martin, what do you think about that?
Yeah, well, when you think about, treatments that we provide for patients, medicines is the largest treatment that we use in healthcare. And so the opportunities for error are huge. If you think about the number of patients we have across Metro North and the number of medicines that are administered each day in our facilities, there's huge opportunities for things to go wrong. But, we want to support patients to get their medicines safely. So there's a whole host of systems and processes that our medical staff, our nursing staff and our pharmacists use to help support patients to get their medicine safely.
So it sounds like we're getting a lot of things right for medication safety. What are the areas we need to work on?
So there's a host of medicines which are termed high-risk medicines. So that's things like antibiotics, potassium and concentrated electrolytes, insulin, narcotics or opioids, chemotherapy, heparin and anticoagulants. And they're called high risk because if something goes wrong, catastrophic outcomes could occur for the patients. Mm-hmm. And so there are always risks with that. So I think we need to continuously learn from errors that occur and implement strategies and change our systems to improve that, to prevent those from happening again. We're fortunate that we have the ability to voluntarily report incidents that occur so that we learn from them.
What's one of the better strategies you've seen in terms of a systems intervention for improving safety around medication administration?
I think that similar to what we've already talked about, I think going back to identification of a problem, that direct feedback to clinicians to support patient safety is probably one of the most effective interventions. When somebody comes up to you and says, hey, I've come across this seems unsafe. Are you sure this is what you meant? And then they identify, oh no, that was an error I made, and they fix it up. That direct feedback to the prescriber or to the nurse or to the pharmacist is fantastic. We've had 15 years, or for the last 15 years, we've had pharmacists undergo competency evaluation feedback through a peer following them and giving them feedback on how they perform their work. We're really fortunate in Metro North. We've got Karen Davies, whose PhD was the development of a similar tool around medicines administration, evaluation and feedback. And there's also similar evidence for prescribers as well. So I think we need to continue to embed that culture, whether we use formal or informal tools. But I think that's a huge opportunity to improve that culture for patient safety, but also improve medicine prescribing, dispensing, administration, and ultimately outcomes for patients.
Mm-hmm. Dale, what do you think in terms of improvements and the future of this particular standard? Where do you think you see improvements and growth happening?
I'm very happy to have been a part of analysis of certain incidents that have happened and how they occurred, why it's happening, what went wrong, and how do we then make a process so that won't happen again. And it's heartening to see that. I've seen it at an executive meeting level, but I've also seen it a lot at Standard 4 where they take particular incidents that happen and look at them. So I have a confidence as a consumer that they're constantly looking at these areas and monitoring and maintaining standards in that area.
I am loving hearing what Dale is saying because I think Dale is describing the perfect intersection between the clinical governance standard and standard for medication safety, which is about having the right systems in place, learning systems that go, sometimes we will make mistakes But what we should do as a health service is to learn from those mistakes, to understand where the system has fallen over, sometimes just temporarily, most often temporarily, and to understand the ways that we can change things so that we can prevent those errors happening again. So music to my ears, Dale. Thank you.
How do you think it will affect clinical areas as they're being assessed on this standard?
I'm very excited about the move to short notice assessment, and this has always been the intention of the health ministers across Australia for the last 10 years. That was that we would get to this point, which we'll reach on the 1st of July. Short notice assessment tests the system in real time rather than with orchestration and planning and scripting usually. So what we'll actually see is assessors arriving with very little notice to an organisation, certainly not enough notice to change anything. Not enough notice to have dress rehearsals. And they'll see the system as it really is. And we've got nothing to worry about in terms of showing assessors our system as it really is. Dale and Martin have both described really robust systems around medication safety that are embedded in learning from what we do every day, that are embedded in working together as a multidisciplinary team with the patient at the centre of everything that we do, and remembering that we have much to learn from patients too, particularly about their medications and the effect that those medications have on them.
Martin, are you even a little bit nervous?
No, look, I would be happy for them to come tomorrow. Honestly, I really don't mind. I think the biggest challenge that we face is concerns that staff have with people coming, and I think. And the message I try to get out there, it's what you do every day to help your patient get their medicine safely. And examples, very simple things, so if you think of a nurse as you're administering a medicine, checking the 6 rights, making sure that that's followed. If you're giving an infusion, you're using an infusion pump, which has medication safety software, and your lines are labeled. Like, these are simple things which are embedded in practice, which support patients to get their medicine safely. And I think it's about that understanding that it's those practical things on the ward that are to occur. You don't need to know what the 15 actions are under the medication safety standard. That's things that Grant and I need to know, but it's what you do to support patients to get their medicine safely. And that's really the message that I think we need to be getting out to our staff. And in my experience, when I've gone around and asked staff, so what's your role and how do you support patients to get their medicine safely, they usually are really quite good at being able to articulate that.
That's awesome. Grant, have you had that experience?
Absolutely. I 100% support everything that Martin has said. People have got nothing to fear in relation to assessors and being quizzed about how they meet the requirements of Standard 4. It's about how do they find out information about a medication that they're not familiar with. I am absolutely confident that every single person across Metro North who has a role in prescribing or administering medication, or indeed dispensing medications, knows exactly where to go to find that information when they are able to say, well, actually, I'm not sure about that. I'll check, because that's what we want to hear from our clinical staff when they're not sure. Absolutely confident that people do the right thing every day about giving medications, about prescribing them, about dispensing them, about managing them, because there's pretty tight regulations and legislative requirements here. Everyone does the right thing.
That's fantastic. There's nothing that sort of typically trips people up or anything to be kind of extra mindful of.
I think one of the things in the system that does trip people up sometimes is that we're so busy across lots of parts of the organisation, and the high-risk drugs that Martin talked about become challenging for us then to manage, because we've got to have another person to walk that whole walk with us until that medication gets to the patient, and even then whilst it's being administered. So that's tricky sometimes, and it poses a particular challenge to people. Take a deep breath and wait. is my advice to people, because that 2-person check is what's making sure that we provide those high-risk medications safely.
Dale, I see you nodding there. What are your thoughts around this?
Well, with those high potency medications, I know technology is helping as well. I'm one hospital home that's at Stars that has a lot of the modern stuff, digital stuff, and Pyxis machines and all that. I know that that's providing a new level of safety that's coming along in the pipeline. It has its own challenges as well, of course, but I think that all of those things helped to help the patient to know and recognise that if I'm on a strong medication, that it's going to be done right and with the best possible care.
Well, any of the other issues that are typical for you, Martin, in things that are tripping people up during accreditation?
Yeah, I think that we just need to make sure, like I've mentioned, we do what we do standardly every day. I think that there are some things where we might get a little bit lax about these sorts of things. So when I think of things like medication storage and our storage areas, it's very easy just to leave those unlocked. But, there's, like Grant has said, some strict legislative requirements around those. So that's a really simple and easy thing that we can do. We've talked already about, the quality improvement work and where we're learning. And it's really useful to understand and know exactly what your ward and your clinical area is working on to support improved medication safety.